Hi everyone, it's Amy, and I'm going to be talking to you all about feminist therapy. So, first of all, I want to kind of just take a second to talk about what feminism is because I know it has become a bit of a hot button topic. There's a lot of definitions out there. When I typed feminism into Google, it said the advocacy of women's rights on the basis of the equality of the sexes. Merriam-Webster Dictionary said, the belief that men and women should have equal rights and opportunities. And in the song Flawless by Beyonce, says feminist, the person who believes in the social, political, and economic equality of the sexes. These all help us to get an idea of what we can expect from feminist therapy. And then feminist therapy, as defined by Laura Brown, is a postmodern, technically integrative approach that emphasizes the analysis of gender, power, and social location as strategies for facilitating change. Also, on a bit of a side note, I wanted to point out that the use of feminist therapy is interpreted differently by different people, which I was kind of confused about this when I first read it, so just to clear it up, Dr. Wagner informed me that some people believe that feminist therapy is meant to be used independently from other theories to help clients, so just solely using its techniques and strategies, whereas other people kind of see it as just a lens to use when working with clients, along with their own theory of choice. So with that in mind, let's begin. So here I just included some images that I liked, and they fit with the theory pretty well, so here they are. I think they're cute. I also included this little comic because I think it's funny. Okay, so now we're going to jump in for real. So feminist therapy was not founded by just one individual, but rather it was a group of female therapists, so it was a collective effort, which is very on brand, I would say, for this theory. So there are a lot of women that contributed to this therapy, but I'm just going to talk about some of the ones that were listed in our textbook. So first of all, we have Dr. Jean Baker Miller. She was born in 1928 and passed away in 2006, but I just wanted to include her, birth year here because I think it's really awesome that she got her MD and everything in a time that women really were not equal. So I'm sure she encountered a lot of challenges during all this, but she was very successful. So I think that's very inspirational. But anyway, she was a psychiatrist that wrote a lot of books concerning the psychology of women and was key in developing relational cultural theory, which is something we're going to talk about more a little bit later on. After she passed away in 2006, Susan McGee Bailey, who was the executive director of the Wellesley Center for Women, she said this about Jean. She said, Jean's feminism was strong, compassionate, and unwavering, never militant, but radical in its implications. Her work and her theory are not just for psychologists, nor just for women, but for all people everywhere. So I thought I would include that little quote because I think it is very encompassing of what this whole theory is about. So some other key figures included Carolyn Zerby Enns, who has contributed to multicultural feminist therapy, Olivia M. Espin, who has done a lot of work with expanding understanding on working with Latino women and immigrant and refugee women, and Laura S. Brown, who has wrote many important books for feminist therapy that are seen as sort of foundations for feminist therapy as a whole. So where was feminist therapy created and what was the context? So feminist therapy has its roots in the United States. The first wave of feminism in the US occurred in the late 1800s and was mainly focused on women's suffrage or the right to vote. But it wasn't until the second wave of feminism in the 1960s and 70s that feminist therapy really began to take root. So in 1963, there was a book published called The Feminine Mystique by Betty Friedan, and it challenged the belief that a woman's fulfillment comes alone from being a housewife and a mother. So, this book is actually sometimes credited as sparking the second wave of feminism, and it actually inspired some of the works of Jean Baker Miller, who I just talked about in the last slide. But the second wave of feminism took on a wider array of issues than the first wave, so it included sexuality, family life, the workplace, reproductive rights, and domestic violence, just to name some. This really called attention to how social and political forces affect the mental health of individuals rather than just focusing on the intrapsychic aspects of mental health that had been traditionally used before. So, yes, basically, this second wave of feminism just got some therapists thinking that some changes needed to be made. So, they did. So, what need did feminist therapy fill, and why was it created? So, feminist therapy was founded because up until its creation in the 60s, all traditionally taught theories were created by white men and thus failed to grasp a full understanding of what it means to be a woman or what it feels like to be in an oppressed group. Feminist therapy was created with underrepresented, marginalized populations in mind. It was created to empower these clients and to advocate for social transformation for the betterment of all individuals. Basically, feminist therapy filled a need because it made therapists and counselors look at clients in a socio-political and cultural context rather than on just an individual level. And it forced us to recognize how a person's social identities contribute to their mental health problems. So, how does it differ from other theories? Well, like I said earlier, feminist theory is different than other theories we have learned about because it was created solely by women and it's firmly based in feminist philosophy. Up until this point, the only other theorist that was overtly pro feminism was Adler, and I think we could also probably say Rogers, probably thanks to Natalie. Thank you. But because of the foundational feminist philosophy, this theory differs from others because it puts a large emphasis on addressing the oppressive environmental factors that clients were facing, rather than just placing the cause of a client's problems within themselves as something that they can just change on their own. So we're going to get a little bit deeper into the theory now and talk about the principles of feminist therapy. So there are 6 main principles of feminist therapy. The first one is the personal is political and critical consciousness. So if you're like me, I was just like, what, when I first read this? But so it actually means that feminist therapists recognize the impact of political and societal forces on an individual. So I feel like this principle really captures the essence of this theory. So if there's going to be like one principle that you remember, I think this is a pretty good one to remember. Well, I mean, they're all important, but this one's pretty good. So the second principle is commitment to social change. This means that feminist therapists are advocates for freedom of gender role expectations, and they also encourage clients to advocate as well so that real change can be brought to society as a whole. The third principle is women's and girls' voices and ways of knowing, as well as the voices of others who have experienced marginalization and oppression, are valued and their experiences are honored. So this one is pretty self-explanatory. The fourth principle is the counseling relationship is egalitarian, meaning that the counselor and client work collaboratively and the counselor does not take on an authoritative role. The fifth principle is a focus on strengths and a reformulated definition of psychological distress. This means that feminist therapists do all they can to avoid pathologizing clients. And the last principle is all types of oppression are recognized along with the connections among them. This means that feminist therapists view clients in the context of their sociocultural environment and recognize their full social identity, not just their gender identity. Moving on to the therapeutic goals. The therapeutic goals of feminist therapy are empowerment, valuing and affirming diversity, striving for change rather than adjustment, equality, balancing independence and interdependence, social change, and self-nurturance. So why are people going to counseling? Why are they hurting? Why are they suffering? From a feminist therapy standpoint, I hope you guys have started to kind of pick up on their belief of what causes these things. But just to reemphasize, feminist therapists believe that individuals hurt because of socio-political and cultural environmental factors that are forced upon them. So I'll use myself as an example. There have been many times in my life where I have experienced pain or anxiety because of my social identity as a woman. As a woman, there are certain anxieties and fears I have that I don't think I would experience as strongly or maybe even at all if I were a man. So, anxiety over being alone at night, anxiety over my body image, anxiety over trying to find a balance between being sweet and feminine, yet assertive enough that I'm not walked all over, but not so assertive that I'm seen as bossy or aggressive. Having the identity of being biracial on top of being a woman has further complicated how I interact with the world and how others view and interact with me, but I won't get into that too much because I think you guys get the point. There are many things that people in oppressed groups are subjected to that are societal norms, and they create feelings of hurt and suffering. So we know why people are hurting. So what can we do to promote change? So feminist therapists believe that change is promoted through raised awareness of how one's social identity impacts their life and mental health, empowerment of the client through the therapeutic relationship, and involvement in social action. And I'm going to talk in more detail about these things throughout the rest of the presentation. So we're going to start getting in deeper to more of the key concepts of feminist therapy. So one of the first key concepts I want to cover is the different constructs of feminist theory, which make up how feminist therapists approach clients. So the first construct is a gender-fair approach, which means that feminist therapists avoid stereotyping clients by rigid gender roles and recognize that gender is a social construct, not an innate behavior. Next, feminist therapists use a flexible, multicultural perspective, which means that they use techniques that can be used with a diverse group of clients. Another construct of feminist therapy is interactionist views, which means that they use social context and environmental factors to relate to a client's thoughts, feelings, and behaviors. And the last construct is lifespan perspective, which means that feminist therapists believe that individuals can change their personality and behaviors at any time, rather than just fixating on development during childhood. So moving on from constructs, another important key concept of feminist therapy is their perspective on personality development. So to sum it up, feminist therapists believe that men and women are brought up differently according to their gender, and this is what shapes personality. And the textbook refers to this thinking or belief as engendered lives. Sorry, I lost my train of thought for a second. But I think this is very true. If we think about when someone is born, and even before they're born, they're already starting to be socialized to fit into that specific gender norm. So, I mean, we think about gender reveal parties. If the baby is a boy, then everything is all blue. If the baby is a girl, then everything is all pink. So it's kind of crazy how before someone is even born, they're already starting to get pushed into what society expects of that gender. So it's, I think, easy to see how your gender really does strongly shape your personality and who you are. But feminist therapists also recognize that men are seen as the dominant group and women are seen as the submissive group. And then both men and women start to adopt personality traits to help them fit into that said group. Um, but feminist therapists work with women and men to make them aware of this personality development during the therapeutic process, and they encourage them to embrace and accept what have been traditionally labeled as feminine and masculine traits, both. Another key concept of this theory is relational cultural theory, which was developed by Dr. Jean Baker Miller, who I talked about earlier. And this theory frames women's focus on connections and relationships as a strength and a pathway to healthy development, rather than seeing it as some sort of weakness. So this theory states that women are continuously moving through connections, disconnections, and enhanced transformative relationships throughout their lives. This theory is meant to help clients continue to build authentic and healthy connections with others and recognize and heal from the hurts of disconnection. So I went on the website of the Jean Baker Miller Training Institute, and they described relational cultural theory as an approach that is used to understand the complexities of human connection and to explore the personal and social factors that can lead to chronic disconnection. And I was also reading an overview of the book Relational Cultural Therapy by Dr. Judith Jordan, and found that this theory recognizes that disconnections are often the outcome of racism, classism, and homophobia, which I found interesting, and I feel like this shows just how multiculturally friendly this theory is, which I think is really great. So moving on to the good stuff. I mean, it's all good stuff, but the therapist role and the client's experience of feminist therapy. So in feminist therapy, the role of the therapist focuses on empowering the client and helping them to become aware of what they have been socialized to believe. So that goes back to these just like gender norms sort of things, such as women are overly sensitive or men shouldn't cry. But the therapist maintains a very collaborative approach with the client and does not assume this role of all-knowing expert. And this is intended to avoid creating a power imbalance in the relationship, which is just very important in this therapy overall, because feminist therapists really recognize that a lot of clients are coming in that are already having struggles with power and feeling maybe a loss of power. So we don't want to perpetuate even more imbalance with that. So that's why it's really important that they emphasize that egalitarian relationship. And the therapist is also very empathetic and very present in the therapeutic relationship. And they even use self-disclosure whenever it's appropriate, of course. And as for the client's experience in feminist therapy, they should expect a very hands-on approach and the assumption that they are the expert on their own life. And again, this is sort of to work on that power perspective. It's to give them that sense of power. But clients are equal to the therapist in deciding what goals they want to work on and what they want to talk about. Clients will be given the chance to look at their life and the world from a new perspective, and they're allowed the opportunity to work through all the emotions that come with this. So another important aspect of the therapeutic process of feminist therapy is their use of the DSM, or rather the resistance to using the DSM. So feminist therapists argue that the DSM is based around what is considered normal to the dominant, or what is considered the normal or the dominant culture, and thus it can't really accurately or appropriately be used on diverse clients. And an important part of feminist theory is acknowledging how environmental factors affect a person's mental health, and the DSM does not appropriately consider these factors. And additionally, feminist therapists feel that inappropriate use of diagnostic labels can really further stigmatize the client and create an even bigger power differential, I don't know if I said that word right, so I'm sorry, but between the therapist and the client. So instead of primarily focusing on a diagnosis, feminist therapists, in their assessment, they're really focusing on the client's wellness, their strengths, and their resilience. Okay, so the techniques and strategies of feminist therapy. So they use a variety of techniques and strategies when working with clients, and some of them are borrowed from other theories, but others are unique to feminist theory. So some strategies that are unique to feminist therapy are those that are aimed to raise the client's consciousness of what they have been socialized to believe. And then just some of the techniques and strategies used are empowerment, self-disclosure, gender role or social identity analysis, gender role intervention, power analysis, bibliotherapy, assertiveness training, reframing and relabeling, social action, and group work. So I won't go into detail about every single technique, but I do want to talk about some of them. So gender role / social identity analysis is a technique used to deepen a client's understanding about how their social identity and the accompanying societal norms / expectations have shaped who they are. And I really feel like this technique is just used to get clients to start thinking about their lives from a perspective maybe they don't always think about. And it primes them to have more in-depth discussions and realizations later on. And then gender role intervention is the point where things really do start to get deeper. I think clients have, at this point, analyzed their social identity, and now they begin to see how societal expectations surrounding their identity have affected their mental health. And then another technique is power analysis, and it's meant to help clients understand how unequal access to power and resources impacts people. And this technique is meant to encourage clients to identify ways that they can take back power in their lives. And if you remember, I was just talking about earlier about the huge just impact and importance of power in this in feminist therapy. And another technique is social action. And this is important in feminist therapy because it helps clients to draw this connection between their own personal experiences and society as a whole. And feminist therapists really encourage their clients to participate in social action or social justice events because it can really help them to feel empowered and increase their self-esteem, and it really starts to create change on a larger scale. So I do want to address the role of men in feminist therapy. So although this is called feminist therapy, it does not mean that this is anti-men. In fact, men can become feminist therapists and they can benefit from feminist therapy. Of course, before a man begins to practice as a feminist therapist, it is really important for him to understand his own male privilege and for him to be a very active advocate for women's equal rights. And then as for male clients seeing a feminist therapist, they can really benefit from this type of therapy because men are also affected by society's gender role expectations in a way that is limiting and oppressive. Men are socialized in a way that does not allow them to express their emotions in a healthy manner, and they are pressured to be strong, protective, and providing. So feminist therapy gives men a safe place to explore how their gender has affected them. So yes, men are welcome in feminist therapy. So we're getting pretty close to the end here, and I just wanted to talk about some of the contributions of feminist therapy. So some of the key contributions include a raised awareness on how a person's social identity and oppressive environmental factors affect an individual's mental health. And another important contribution was the focus on social justice and how it goes beyond creating change in just one individual's life to creating change for society as a whole. And the book has several other contributions that feminist therapy has made to the counseling world, so I would recommend checking those out if you have not read them already. And although there are some great contributions and wonderful things about feminist therapy, just like anything, there are some limitations and criticism. So, the major criticism of feminist therapy is the risk of the therapist pushing their values onto their clients. So, feminist therapists clearly feel passionately about the power imbalances between men and women, and they're social advocates for gender equality. But it's really important for them to remember that not all clients are going to feel as strongly about this as they do. And so it's possible for feminist therapists to end up influencing clients to adopt the same values as them. So it's really just essential for feminist therapists to remain self aware and be appropriate with their self disclosure. And then another possible limitation to this theory is its focus on environmental factors with little focus on internal factors. So, in most ways, this is a big strength of this therapy, but it can possibly be damaging if a feminist therapist is unable to recognize the difference between what is caused by an environmental factor and what is more of an internal factor. And one last limitation that I want to talk about is the lack of proper training for feminist therapists. So there actually is not a credential to recognize official feminist therapists. So there's really just this lack of quality control, and pretty much anyone could consider themselves a feminist therapist, which is kind of scary to think about, that anyone could just say, I specialize in this, I do this, since there is no credential behind it. No one can really question it. So that's a little frightening to think about. But yeah, so those are just some of the limitations. And last, I'm just going to give you guys a brief summary. So, feminist therapy, it was created as a collective effort by numerous women. Feminist therapy came to be after the second wave of feminism in the 60s. Feminist therapy focuses on external factors by viewing problems from a socio-political and cultural context. Feminist therapy recognizes and validates the unique challenges faced by women and other marginalized groups. Feminist therapy is empowering and egalitarian. And feminist therapy seeks to increase feminist consciousness and societal change. And I did want to share just some of my thoughts with you guys about this therapy. So first of all, I was really excited to sign up for this presentation because I am really passionate about feminism. It is very important to me. And so I really enjoyed reading this chapter and getting to put together this presentation for you all. And when reading about several of the other theories in our book, I found myself really questioning their validity at points, just due to the lack of awareness or consideration for environmental factors. So I was so happy to see that this was a huge part of this theory. And I would find other theories would frustrate me as they operated sometimes under this assumption that a person can change if only they apply themselves, and it really, some of them would give me this pull yourself up by the bootstraps vibe, which I do not vibe with that. And I think it's so important to recognize that, unfortunately, not all people are born equal, and we need to know that if we want to stand the chance of truly and effectively helping them. So I think feminist therapy does a good job of capturing that belief, and even though I do not see me dedicating myself fully to this theory, I'm definitely going to be implementing this feminist philosophy into my own work. And now that you guys have heard some of my thoughts, I'd love to hear what you guys think. So I came up with a few self-reflection questions that I would love for you guys to answer. First of all, what is your social identity and how has it impacted your life? Second, do you believe you would benefit in any way from working with a feminist therapist? Why or why not? And lastly, do you think feminist therapy should be used as a standalone approach or as a lens or mindset that can be combined with other theories? So I'm looking forward to reading all your answers, and I hope you guys liked the presentation. Thanks for listening.